In 2010, I was having a screening mammogram and they found that I had DCIS, the precursors of cancer. And so I was sent off for surgery and I ended up having to have 2 lumpectomies. And then that was followed by 6 weeks of radiation treatment a couple of months later. So when I saw my GP about 12 months after my surgery and I'd started to notice some swelling in my breast, he recommended I go and see a physio for a little bit of treatment to reduce that. It was the physio who told me that what I was suffering from was lymphedema. Nobody had talked to me about that before then because I'd had no lymph nodes removed as part of my surgery. But in fact, it looks like it was probably the radiation damage that had caused my lymphedema. She did a little bit of work with me at that stage and it seemed to settle. But by the time I saw my oncologist in March of the following year, she identified me as needing a lot more, like it needed dealing with in a more serious way. So she recommended that I come up and come to Mount Wilga and see Dr. Mackey for that. So since I've been here at Mount Wilga, I've been seeing physios, doing massage on the breast area and other parts of my body to get my lymph nodes working, I guess, get everything working. And I also do exercises in the gymnasium, and it'll use the pool, the hydrotherapy in the pool. So I'm doing 2 visits a week and a 4-week program at the moment we're trying. Well, certainly I'm starting to see a lot of the tissue, the scar tissue and the tissue that was damaged in my radiation treatment is starting to break down, and I'm getting a lot less of the swelling that I had when I first started coming along. And I'm being given a lot of exercises and things to do at home to keep continuing to manage that going forward. Each morning when I get into the shower, I do some stretches, some neck stretches and some shoulder rolls, and then actually massage the damaged tissue where I had the radiation treatment particularly. Later in the day, sort of before I'm going to bed at night, I'm doing some massage of the stomach area to stimulate the lymph down there, and also try to sit as often as I can with my arms stretched out behind my back, or my head sort of like this, so that I can actually keep everything stretched and working. If you're diagnosed with lymphedema, my recommendation is that you get active and do something about it as soon as you can.